Hi there, my name is Pharmacist CJ, your favorite community pharmacist. Today, I'm going to talk about drip, your normal saline. I have titled this video, The Drip Obsession, the Science and Danger of Normal Saline. In Nigeria today, if you go to a clinic and you are not given drip, that is the normal saline, you're going to have this feeling that you have not been treated well. But what if I told you that this clear bag, this normal saline, this drip they are demanding from your doctors and nurses is actually a powerful drug that can damage your kidney and your heart if it is misused. Today we'll be discussing in full normal saline. We'll talk about the placebo effect of normal saline. We will see why this workhorse of the world is a powerful tool, which is a lifesaver and can also be a danger. Normal saline is just 9 grams of salt in water. It is called isotonic because the concentration of the salt in this drip is close to the concentration of salt in our blood. Because of this concentration closeness, it prevents our blood cells from shrinking. But here is the secret. Your doctors know it, your nurses know it, that this normal saline is actually salty. In fact, it is too salty. The human blood has a chloride of about 100. This bag has about 154%. That is about over 50% more salt in this bag than the amount of salt that we have in our body. When a nurse or a healthcare provider puts 1, 2, 3, or 4 bags of this world workhorse into your body, actually overloading your system with salt. This can lead to hypochloremic acidosis, literally making your blood more acidic. Let's talk about the placebo effect. There is actually a pressure on the nurses and the medical doctors, especially in the hospital or if they come to your home, by the patient to hang a bag, to give a drip, to give a normal saline. Most patients tend to believe that injections or IV bag are stronger than any other tablets, but this is far away from the truth. When you use a normal saline for simple problems like fatigue, tiredness, sore mouth, things that can be handled better in other ways, when you use normal saline to handle them, and when a normal saline is given to you, you're actually taking a risk. And I will tell you, number one, the blood pressure trap. Many Nigerians have undiagnosed hypertension. They have high blood pressure, but they don't know it. So if this person who has a high blood pressure but doesn't know it goes to a clinic or calls a nurse to come and give them a drip in the house, and then you begin to give drip to somebody who is already hypertensive, the person doesn't know they are hypertensive. It's like trying to pour fuel to a fire. Why? Because the drip itself is salt. Is filled with chloride. Number two, the malaria typhoid routine. Most often, when somebody has malaria, there is a tendency for the person to have an increased thirst. They want to drink water more. Now, every injection in this part of the world tends to be diluted with normal saline. So if the person is already drinking water because they're having malaria that has caused them to drink more water, and then you are adding normal saline, which you are using to dilute the drug, those normal saline will be retained in the body, and then more water will be retained in the body, and this can lead to edema. So you see somebody who just finished treatment and they come to the pharmacy and tell me that, oh, pharmacy, I don't know what's happening to my leg. My leg is swollen. It's actually because the person has had what we call fluid retention, because the person was drinking water and now more chloride was added to the water. When something goes wrong, for example, the heart is a pump. So when you add too much fluid too fast, the pump might fail to pump effectively. The pump might not be able to keep up. The fluid has nowhere to go, so it leaks into your lung, leading to what we call pulmonary edema. In a busy world where the drop rate of that normal saline is not being monitored by expensive and complicated machine, you cannot be able to tell when the drop rate is high, when the drop rate is low, or when the quantity you are putting into the body system is too much. Because you're unable to monitor, you don't know when the bag runs too fast. Suddenly, a patient who came into the ward or into the clinic, or who called you because they are feeling fatigue, are now finding it difficult to breathe because the lungs are drowning in salt water. So should we stop giving normal saline? Not at all. Because normal saline is very, very important. We can't do without it. In severe cholera, in trauma, or when we want to give IV blood transfusion, the blood bag of normal saline is normally the most trusted route of giving those things. But we need to change our mindset to the patient. Please and please stop demanding drip for every simple thing, for every small headache, for every small weakness, for every small stomach pain. Stop demanding for drip. There are some of these things that you talk about, some of these minor weaknesses can actually be taken care of by ORS, which is safer, which is faster. You don't have to spend much. It's cheaper to the healthcare provider. Let's also have a mindset change. We can tend towards a better IV fluids like Ringer's lactate. They are better, they are safer, because they are kinder to the kidneys. In conclusion, normal saline is a fluid, it's a tool, it's a drug. It is not a tonic. It is not a beer. It is not a juice. Let us all respect the science so that we can live healthier, so that we can live longer. If this video has touched your life, if this video has changed your life, if this video has touched your heart, please do well to share, like, share, and send it to anybody who takes drip at every point in time. You have to understand that drip is a very good drug. Normal saline is a very good drug. But there are better alternatives. Number two, it's not the solution to every problem that you have. Number three, it should not be misused. Number four, it is effective, but it can dry your kidney. It can make your blood pressure worse, your hypertension, especially if that hypertension is undiagnosed. Thank you for listening, and I'll see you in the next video.